But I know, so when Chris Brown, he said these girls ain't loyal. We never loyal to themselves. Nah, check out on the breast them. Ladies, we need to work on it.
Welcome back.
Ladies, let's be loyal to ourselves and start those self-breast examinations, right? So if it is that you are just joining, we're discussing breast cancer, as it is Breast Cancer Awareness Month, and we are gonna get into shortly, although we've touched on quite a few factors, why early detection is important, right? So we went into what is breast cancer, what exactly happens when you do have breast cancer, how the cells operate, all of these things. So if it is that you missed it, it's fine. We record every single Talk the Ting with Kim episode, and we share it on our YouTube channel. So just go over to our YouTube page, check out Funtastic Fridays, and trust me, we have information galore over there, right? So go and check it out. All right, so now we're going to get into what are the first signs of breast cancer. All right. When breast cancers are small enough, there may not be any noticeable changes in the breast. So as if it's small, you may not really see anything. This is why they still recommend that you do the checks and the screening, because it doesn't mean that because you're not feeling a lump means say nothing is there.
And then I watched a couple documentaries and a couple movies as well when the doctor said, I see something, but
I'm not sure what it is.
Yeah, we could go and watch it.
Exactly.
We could go and pray.
So that is why we're talking about early detection, because the key actually is to identify it or detect it before it becomes a lump.
Before it gets big.
Before it becomes that tumor before. So that is why the checks, that's why the focus is just get the screening, get the mammograms. And I know they say when you're 40 and older or 50 and older, but at this day and age, I've been hearing also women in 30s and their early 30s at that getting breast cancer. So ladies, I feel like, boy, the 40 age limit there or whatever minimum, just like prostate cancer, they were saying men once upon a time 50 odd, now they're telling younger 40. Men and 40. They're telling men now to go and start getting tested earlier. Because guess what? It's always evolving. Information is always evolving. The longer we exist, the more we learn eventually. So it may be that we realize now that you can be young and still susceptible to breast cancer, right? So go and go check it out. So as we said, sometimes there's no noticeable changes, and we're hoping that if it is that you do have breast cancer, that is when you catch it. But otherwise, there could also be a tumor in the breast that grows, right? It can change how the breast looks or feels. Now, I remember hearing a comedian talk about this, but they were serious when they were talking about it, and they're saying that men play an integral part in helping women with this,
exactly.
Right? Because we don't know when we're fascinated with the boob.
They are awesome things.
Instead of when I just sit down and fascinated, how not help as well with these examinations? Sometimes
we might get distracted, but...
No, so that is why you have to be serious about these examinations. And if it is that you're very familiar with, this special person's boobies,
and the boobies are familiar with us,
but you would know the differences. You'll be able to see when something is different.
Look right, look normal.
You're like, hold on, I look on them every day, that look off. Something.
I think, Kimmie, based on, I've heard people say this, I don't have, first-hand experience, but, the women bodies are so complex. This day, them say, the breast is firm, next day, it's not as firm.
It's true.
Like, we're weird, though, as women.
We
are.
Weird. It's
complex.
Maybe hormones.
No, that's what I'm saying, it's complex, but at some point, I just say, if you're really paying attention, you should be able to pick up the little bumps or lumps.
Different firmness for different days.
Yes, you've never heard of that? Because I've heard of it.
Or the breast is heavier today.
Exactly.
Or
fuller.
Tomorrow.
It actually gets
and
fuller.
It's fuller.
Yeah.
And different things. Can be time of the month that causes it.
Exactly.
Can be just hormone imbalance.
I can't believe something don't look more than MV, the professional traveling resident
After MV starts off strong, with the definition of cancer.
But the biology.
Trust me, man, it happens.
But we're always learning, and that's what we're here at Talk the Ting with Kim to do.
We're here for you.
All right.
And you're here for us. Big up Chevy Dan, large up yourself with fire.
All right, so common changes as well. So this is the detectable changes that we're referring to.
What to look out for, people?
A lump or thickening in or near the breast area or in the underarm area. So you must always be checking.
Oh, so go up to the underarm.
That's
here,
why
you
the
see
breast tissues are connected.
Them lift up the hand. Sometimes when I do the test, so cut the side part or so.
Something can be around there.
Side boob. Yeah.
Exactly. So you need to check
To the underarm,
under
yeah.
it, the in between, underarm, check around it,
all
right?
around, yeah. So I make them know. Right? More Kimmie voice, I tell them this. According to Kimmie, we say we must go all around.
All around, right? A change in the size or shape of the breast.
Yes.
So that's another thing as well. Ladies, we know we have different shapes of breasts, but it can be that one automatically start changing. And It's not like a one-day thing. It's as we were pointing out earlier, we do go through different changes every month, right? But then you realize over a couple of weeks it's the same thing, or it keeps getting worse, or all of a sudden your boobs just getting big over time. Like you just don't get big for nothing at all. You know, stuff like that. You actually need to really be in tune with your body to actually always be checking, right?
And then, I mean, you have your body, you might be used to seeing it every second of the day.
That's how we said
but
the
when
men.
somebody else know, just here last week it was like this, and this week you can see a bigger change.
Exactly.
You say, but wait there, this I get that lump, it's a lump, something this
Yes.
man. You might not have noticed it.
Exactly.
So ladies, yeah.
So that's why they actually do say that men play an integral part, right? Especially when you have your husband and wife and all them something there, when they play a very integral part. Because sometimes you're gonna be the one for saying, "No, man, babe, something off."
Yeah, because as I
Something
said,
off.
that
You're
happens.
used to it, you know.
Yeah.
And then you also have dimpling or puckering of the skin. So your
dip.
skin might just be smooth, and all of a sudden you start little sinks,
Dip
little
them.
dips, and you wonder what happened to the skin. First, you might think it's an allergic reaction or something, but I must say, if you see a couple of days pass and it's still there, it's something to check out, right? You also have nipple turned inward into the breast.
What?
This one, me don't probably need to see a picture, but
You want to see a picture? You want to see a diagram?
so probably the nipple, as we
I guess
know,
it's
should be
probably-
pointing out, but it's probably going, it flattening, and probably even looking like it's going internal instead.
Or it
Something
probably
to check out.
turn up in, I don't know. Yeah.
Well, check it out. They say nipple turn
whole
inward.
nipple.
Well,
Yeah, I'm thinking
The
it going.
areole and the nipple are two different.
Yeah, the areole is
So
the round part
nipple
round
might
it.
just
Nipple is the
start
sticking out
flatten
part.
out and
So they must say it
exactly.
has start go in.
Man.
Yeah, we get to hear say.
but I get what you're saying.
As I say, these kind of I think we're gonna have in the
Probably some images that we have
fantastic
to-
after dark we're gonna have a live breast so we can
Alive, no sir. All right, another thing as well, another common change
or a
is
sample. We're gonna have a sample.
another common change is discharge from the nipple. So this one obvious, ladies.
Yeah, but that
if you're
one-
having discharge from the nipple, especially if it's bloody,
Oh,
you
now you're
need
talking.
to get it checked
'Cause
out.
I've heard
so not
ladies say
talking
them
about
have
milk,
discharge.
or we're talking about discharge.
And you're not pregnant.
And you're not pregnant, you just have
Okay.
discharge from the nipple. Yeah, that's
Something to look into.
That's something to
All
look
right, I'm
into.
gonna tell ladies them that. 'Cause
Right?
some Jamaica, as in most people in general, you know, we're not really too good doctor, too tough. They will see things start fall apart. But
Exactly.
ladies, if you're seeing this, as Kim said, what you're not
You're not
what do you call it
pregnant,
now?
you're not
You're not nursing,
breastfeeding, you're not nothing like that.
and that's
You're
a
not-
weird, yeah.
And you just
Check
having
it out.
discharge, especially if it's bloody. They have to look into it. And finally, scaly, red, or swollen skin on the breast, nipple, or areola.
Jada,
right?
that's where I wanna-
So you need to also check to see if it's swollen. 'Cause it can be that it's very tender, and you just seem like one breast is bigger than the other. It can be very red. So you know your skin. You know you can tell when your skin is bruised. Even though
Yeah.
we're black, you can
Yeah.
know when there's a bruise.
Yeah, you can see a
might
little
have a
blushing colour
discoloration
there.
and
Yeah.
stuff. You need to look at that. Or if the skin just start get scaly, scrape off scab off of the areola.
Dry
or
skin up
something,
at top
dry
there.
skin or
Yeah.
break constantly. These are things as well that you need to look into.
Nobody
right?
just go add powder, people. Make we go check it out.
Exactly. Or you just keep on add moisturizer, try
More time
soften it
at.
up. No,
Yeah, check
you
it
need
out.
to check it out, right?
The doctor.
So, adult women of all ages are encouraged to do a breast self-exam at least once a month, at least.
What?
Right? At
Oh,
least.
okay.
Women often feel a lump in their breasts, which prompts them to seek more screening. A self-exam can help you become familiar with your breasts so you can notice any changes. So, ladies, the more you check it out, gentlemen, the more you check it out for your too, it's quicker that you'll be able to help to identify, like, babe, no, something off here, so you know, right? However, it is recommended that women, even though we can do the self-exam, we not rely solely on that.
No.
Like I said, sometimes breast cancer don't have no sign. You
Right.
have a lump.
Sometimes the
You
sign
have
isn't
nothing.
noticeable from that angle. That not try
Exactly.
get at it.
So
Yeah.
if you just take the test, you will know, right? So self-exam, as I said, we're encouraging that, but then we're also recommending that women have regular clinical breast exams and screening mammograms.
How often?
These can help detect breast cancer early. It's actually once a year, they say. At
Okay,
least.
once a year at least.
Once
okay.
a year.
All right.
These can help detect breast cancer early, which can allow for early treatment. Women should be familiar with how their breasts normally look and feel and should report any changes to a healthcare provider right away.
Ladies, know your breasts.
Yes. Now, I see what you did there. Now, we can get into why early detection is important. Breast cancer that's found early when it's small and has not spread is easier to treat successfully. So, ladies, I know that we're fearful. We're thinking that, me not getting a check and prefer not knowing, because we don't want to stress there, and, But guess what? If you actually identified early, it helps you way more. You have a higher chance of actually treating it, right?
It's I think it's like something that it's gonna spread people.
Exactly. So that's what I'm saying. When it's small and has not spread, right? So getting regular screening tests is the most reliable way to find breast cancer early. According to the American Cancer Society, when breast cancer is detected early and hasn't spread, they keep pointing out, and hasn't spread, the 5-year relative survival rate is 99%. So within 5 years of detection, if it's detected early, you have a 99% rate.
High chances.
Or chance of survival. That sounds good to me. I don't know about you.
You know I'm going to lower than that.
Out late, and then you have a 50-50 or a 20-80 with 20 being your chance of living. No, we don't want that, right?
Early detection is
so key. Early stage breast cancer is often more treatable and has a better prognosis than late stage cancer. Breast cancer is sometimes found after symptoms appear, but many women with breast cancer, as we said earlier, have no symptoms. Now, here are several other reasons why early detection is important as well. Number one, we listed number one, which is that it's easier to treat. So number two, less aggressive treatment. So detecting breast cancer early may allow for less aggressive and less extensive treatments, such as lumpectomy. This is called removal of the tumor instead of a full mastectomy, which is removal of the entire breast.
Whoa.
So ladies are very...
Stick away, papi.
Yeah, man. Ladies are very fearful. This is why they don't want to go check it out, because they don't want to lose the breast. Because you have some women out here that actually either have one of them or all of them. I actually follow a fitness trainer, and she in her early 30s, and she had to get her breast removed, and when you look, it's just stitches.
Yeah.
Right? And she's in her early 30s, which is why I'm saying, ladies, don't wait till you're 40. Don't wait till you're 50.
Yeah, that Jada?
Get it checked out now, right? So the earlier you find it, it's easier to be dealt with. You can actually remove the tumor because it's not spread. So guess what? The key is remove the tumor.
Yeah.
Right? And you can actually still have breasts.
I know.
But if it takes too long, the whole breast have to go.
If the breast is removed or are removed, nothing would it would affect us as men a little bit, but
the lady
as
who
long as
both
the
of
other
them
thing is still intact.
But the lady who actually lost her breast because of it, she's married, and her husband very supportive. Actually, after that, she's actually pregnant right now.
Envy. But here's the thing, envy. You see, the key thing with that envy, the key thing with that, you have to find somebody you love.
Yes, you have to be
genuine love. Once it's not genuine love, as breeze blow, them say, well, me not like you again. Not tell you.
As long as the other thing is intact.
Envy.
That's how envy focus.
No, but I'm letting you know that other man left woman relationship for less than that.
Right?
Girl cut her ear, boom, gone.
But I think it's just an emotional.
Yeah, it's gonna be a roller coaster for the person.
It is.
That had,
man.
Actually have
and I love that she has go through it, right? Yeah. It takes a lot, man.
So it's a
I would be supportive is all I'm
lumpectomy is removal of the tumor.
lump. So them go for the little thing alone.
So them take out the issue.
But if it's spreading too far, they're gonna have to do a mastectomy.
Yes.
Which is the removal
of the entire breast.
Oh, geez.
So if it's one breast, they remove that one. If it hasn't spread to the second one. So if it's one, you may end up with one breast. Or if it is that it's actually spread to both of them, they have to remove everything. If not, and it gone to other areas of the body, that's a whole other kettle of fish. Which is why they're recommending that early detection. Just get the tests done. Just get the screenings done. Like, it's better you know than you don't know.
Know your
when
status.
you find out, you probably drop down one day, then you go hospital, doctor tell you, say, this are going, it seems like 6 years in now. it's a whole different kettle of fish, right? So it's better you find out early. Another reason or another benefit of early detection is improved quality of life. So early detection can help preserve breast tissue and minimize the physical and emotional impact of cancer treatment. This can result in a better overall quality of life for the individual. Number 4, lower healthcare costs, right? So just know, so the worse it get, the more the money.
Exactly.
Because you
more work
you
has to
need
be done.
more expensive equipment. Now you need some more severe treatment.
More aggressive treatment.
Just to live. So it's going to cost more. So if you address it early, you save some money, right? So lower healthcare costs. Early detection can lead to less expensive and less invasive treatments. Because you know, the more invasive the treatment, the more money it take. And then you have to pay the doctor as well for them time. So it's a whole heap of things. Detecting breast cancer at an advanced stage often requires more intensive and costly treatments, including surgery, chemotherapy, radiation therapy, etc. Right? So another benefit. Another one is improved long-term outcomes. So detecting breast cancer early can lead to better long-term outcomes with a reduced risk of recurrence, right? So that whole thing of what do you call it, regression? Or the cancer come back, the sooner you treat it, you actually reduce the risk of it reoccurring, right? Mm-hmm. So regular follow-up. So if it is that you are a breast cancer victim, and you deal with it early, all you have to do thereafter is regular follow-ups and surveillance after treatment, and this can help to catch any potential recurrences, all right? Now, number 6, greater treatment options. So early detection opens up a wider range of treatments. Clinical trials and targeted therapies are often more effective when breast cancer is diagnosed at an early stage. So you have more options. You can pick, choose, and refuse. You probably don't want to go through radiation. You probably have some healthy, because some people believe in the natural herbs and stuff. You may have that as an option. But the longer you take and the worse the worst stage of the cancer is, then your options limited. Chances are they're probably going to tell you chemo or radiation, which nobody wants either one of them, because that's a whole kettle of fish by itself, right? Number 7, increased awareness. Regular breast cancer screenings and early detection programs promote breast health awareness and encourage individuals to take proactive steps in managing their health. This can lead to better overall health and well-being. So, of course, they're going to encourage you to lose weight, eat better, drink more water, take better care of yourself. So, all that are also benefits of it. And finally, another benefit of the early detection is the emotional and psychological benefits. Knowing that breast cancer is detected early can reduce anxiety and fear associated with the disease. It also allows individuals to make informed decisions about their treatment and take control of their health. So when you find it out earlier, we're not going to say, boy, it's not going to hit you like a ton of bricks. It's going to. But I would feel better knowing we have a 99% of surviving, a 99% survival rate, compared to finding out late and then the doctor said, boy, the most you can do is try and make your life, enjoyable for the next couple of, for the next 6 months. That's a 2 different level of stress. That is 2 different levels of anxiety. And not only that, the cost that can come with making me comfortable for the next 6 months as well, knowing that death is inevitable. No, that not feel good. So let's work on that, right? And we're going to wrap up shortly. So risk factors you cannot change. So that was one of the things that Lana said earlier when I said, just being a woman. And he said, but you're not in control over that. So we're pointing out some risk factors that women, we can't change it, right? Getting older, we can't change that. The risk for breast cancer increases with age. Most breast cancers are diagnosed after age 50. We're not under control because we have to get older. Genetic mutations. Women who have inherited changes to certain genes. I've always heard about the BRCA genes. I've never researched it. I've always heard it in movies. And every time there's like a sad scene, oh, I went to the doctor and I found out I have the BRCA gene. I always wonder what it was. I know it was cancer related, but they're saying that if it is that you have inherited it, whether from parent, some family member, you can't change it, right? But you can learn to deal with it. Reproductive history as well. So as we said earlier, for girls who started their menstruation before age 12, you're at a higher risk. And for ladies who enter menopause at a later age, you're also at a higher risk. That's something you can't change. Having dense breasts, as I say, it's not necessarily big breasts, so we don't want to lay them things say, oh, because of outer boobs, I'm more susceptible. Everybody's breast basically tissues are made up differently. Some have more fat, some have less fat. You can actually have a smaller breast person who have more fat than you in your breast, depending on your build up and your genetics and all of them something there, right? So it's not about having big breasts, but dense breasts. And once again, that is found when you do the mammograms. And they said generally you're more likely to have dense breasts if you are younger, if you are pregnant or breastfeeding, if you are taking hormone replacement therapy, and also if you have a lower body weight. So that's why I said, don't think, say, ladies, because you have big breasts means that you're breast dense. Somebody slimmer than you can have denser breasts than you, all right? Another thing you can't change is your personal history of breast cancer. You can't change that. And you can't change your family history of breast cancer. Now, why I've mentioned that because I want you guys now to notice things that you can change, risk factors that you do have control over. Number 1, be more physically active. Women who are not physically active have a higher risk of getting breast cancer, right? Number 2, aim to maintain a healthy weight, especially after menopause. So that's a ladies for our heights. You can go and Google it. Find out what is the ideal
Body
weight
mass
or the
index.
expected, for and whatever your height is, and it breaks it down for you, right? So aim to maintain a healthy weight. Older women, especially who are overweight or have obesity, have a higher risk of getting breast cancer. Another thing is reconsider taking hormones. This is a risk factor that you can control. If I have a conversation with a doctor, especially a woman who I have a friend that says she wants to come off it, but because her time of the month is horrible without it, she just lives on it. But you probably forgot basically see if you can find an alternative. Talk to the doctor, find there's another thing you can do because it's going to increase your risk, right? Also, having the first pregnancy after age 30 and never breastfeeding ever, makes you a bit more susceptible. This is a risk that you can change and can't change, because we're not out here just trying to have kids because we both turn 30 and we do have breast cancer. But it's just something that you need to be aware of. So, ladies, if it is that you do have children, it's recommended that you breastfeed. This helps to reduce the risk of breast cancer, right?
And while you're on the topic of breastfeeding, there's a quick entry here. There was a question to say if whether, sucking on, partners' breasts aid in the reduction of the risk.
Yeah.
Scientists have said there's no...
Breastfeed.
Yeah. Yeah, but, scientists have said that there's no direct relation of having the adult man, on the woman's breast.
Kids.
However, it's just that whenever you are doing such activities, you are more able to notice the changes in the breast. So you are able to help in the early detection process. Yeah.
So, yes, that can help as well.
Right.
And finally, another risk factor that we have control over, ladies, or alcohol consumption.
Right.
Studies show that a woman's risk for breast cancer increases with the more alcohol she drinks.
Cut back on the Casamigos and the Chateritos.
All right. So,
dirty.
Essentially, staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving cancer if it occurs, right? Also, ladies, avoid smoking.
Yeah.
The smoking, something that don't help.
We know the cigarette thing already. They're on the box, people.
And the chemicals that cause cancer, be very careful with those stuff. So to wrap it up, to achieve early detection, regular breast cancer screenings, including mammograms, clinical breast exams, and breast self-exams are essential. It's important for individuals to be aware of their breast health and to consult with healthcare professionals if they notice any unusual changes in their breasts. Early detection plays a critical role in improving the outcomes and overall quality of life for those affected by breast cancer. So when it comes to your body, as we say, you know it best. If you notice anything that isn't normal to you, or if it's something that doesn't feel quite right, take charge and speak to your doctor. In most cases, it won't be cancer, But if it is, finding it early can make a real difference.
There you have it, folks.
So get screened, ladies. Get screened.
If you need a screener.
And chances are there are some healthcare places that actually will have some specials because it's Breast Cancer Awareness Month.